Good afternoon, ladies and gentlemen. It is extremely important to gather knowledge about headache and the overcome strategy. To more about the headache and to increase the awareness of it, today Alteus is extremely privileged this afternoon to welcome you all in the Web with Expert series on Alteus on a very interesting topic, expert opinion on headache. Alteus is one of the fastest growing pharmaceutical organization of India who has marked its presence in different sectors, especially in neuronal health and delivering the solution for each and every Indian. Uh, and also, Alteus is also pledged to increase the awareness and knowledge about neuronal health related disorder within Indian so that every Indian will get benefited. We are privileged as we are having with us today Dr. Pradeep Tiwari, who is an DM Neurology from GB Pant Hospital and Maulana Azad Medical College, New Delhi. He has completed his MD in medicine from Gandhi Medical College, Bhopal, and completed MBBS from TNMC and Balnair Hospital. And also, he has completed fellowship in pain medicine, sleep medicine, United States of America, psychiatry and mental health, Sydney, Australia, and currently consultant neurologist at MGM New Bombay Hospital, Vasi, and Surana City Hospital, Chembur. To make this afternoon more informative for our viewers, I am handing over the session to Dr. Pradeep Tiwari. Over to you, sir.
Thank you. It was a very detailed, description about myself, and I'm very pleased to hear that. Today afternoon, I have called people out of their bed, and it's a very sunny afternoon with a lot of heat going on currently in this season. So probably I think I have made a very right kind of atmosphere for precipitating your headache. So without further delay, I would talk about headaches, which are very common. I mean, the prevalence of lifetime prevalence of migraine is itself somewhere around 10 to 20%. So it's pretty common, and it's a very a very common issue that nobody addresses, and patients are not very satisfied with the current kind of treatment that is available in various healthcare, whether it's pharmaceutical or healthcare services. First, let me tell you about, in brief, about types of headaches. So we broadly classify headaches into primary headaches. I mean, there's no abnormality in your brain, and still you are having headaches. So that kind of category is basically the definition of primary kind of an headache. Then we have a secondary kind of a headache. I mean, there's something, some structurally wrong pathology inside your brain, some structurally wrong pathology inside your scalp, inside your head, which is actually stimulating the pain fibers, and you are having a headache. So with this knowledge, I mean, all kinds of tumors, certain kinds of arthritis, certain kind of hematomas, a lot of things which are structurally there, they all contribute to the secondary headache. And migraine, which you commonly know, which everybody knows about, but then the primary headaches are still a lot in detail beyond migraine. So there's a tension type headache, there is primary exertional headache, there is even there's a family of headaches which is primary headache, which is known as a trigeminal trigeminal autonomic cephalgias. So there you have a trigeminal neuralgia, which is a prototype which you already know about. But then there are very other kind of headaches, like the cluster headache, like the SUNCT. There's this paroxysmal hemicrania. So there's a lot of kinds of primary headache, which is very difficult to diagnose. So if you have a headache, it's always better to see a doctor. It's always better to see a neurologist, because I have seen migraine is a very common diagnosis that everybody gives. But when patient comes to the OPD, we get into the detailed history and examination. We find out that most of these patients are actually not migraine. They are basically belonging to some other category of headaches. So there is the importance of seeking a medical advice is very important, because probably if you are not getting treated, probably you are being treated for the wrong kind of a headache. So that's the first major take-home message that I want you all to know. Second important thing is, you will definitely ask me, ki, sir, how can I differentiate whether this is a primary headache or whether this is a secondary headache? So if do I have something growing up in my head or in my brain, or there's something wrong structurally that is causing a headache? That is what most people feel, because they have, because of the effect of movies and all, people usually think, even if there's a patient of migraine which who walks up to you and you explain him that this is migraine, he is pretty much not satisfied until and unless you get an MRI done, because he has seen a movie where Shah Rukh Khan has headaches for so long and finally he turns out to be a brain tumor. So he's pretty much convinced that he has a brain tumor. So this is again a very sick kind of a mentality that at times doctors have to deal with. But then that's the question, right? So whether you have a secondary headache, whether you have a primary headache, how do you as a patient try to distinguish them, try to seek a medical advice accordingly? So if you have these, I will enlist certain 4 or 5 important points that you must be very careful about. So if you have headaches which are very worse in the morning, the moment you try to get up in the morning and you have a very worse headache, probably we are not dealing with a primary headache, because most of the tension type headaches, they usually get relieved after a good sleep that you had. So that is first pointer where you should be thinking that probably something is wrong. If you have headache which is associated with double vision, or you have a blurring of vision associated with headache, or you have a transiently obscuration of vision where you are, you are not seeing, you are just looking at a particular image and suddenly a black kind of a vision appears for few seconds, which you known as a transient visual obscuration. So when you have that, or if you have vomiting and nausea along with headache, I know migraine also has a lot of nausea, but vomiting per se is a very red flag sign. So if you have a severe headache and you have a vomiting, then probably you must be thinking that you may be suffering from a secondary headache, and you should push for a radio imaging test straight away. Then if you have a old person, like a person beyond age of 50 years, and there's a new onset headache in this person, then that is a red flag sign. Probably you are dealing with a secondary headache. You are not dealing with a primary headache. Third important thing is, if you sleep in the night and you have so severe headache that it disrupts your sleep, and you have to get up in the middle of the night out of sleep because of the headache, then that is yet another indication that probably you are dealing with secondary headache. There's something wrong, structurally wrong inside the brain. So having said this 4 important points, I will again like to enlist them. If you have a very severe headache in the morning, if you are having a severe headache during nighttime, so severe that you get up out of your sleep due to the headache, if you have headache associated with vomiting, associated with diplopia, associated with blurring of vision, and if you are an old person beyond age of 50, you probably never had a headache and now you have started to get headaches, that is probably the 4 classical indication where you should be thinking that we are dealing with a structural or a secondary headache, we are not dealing with a primary headache. Now, primary headaches are, the main focus where medications have to be given and lifestyle modifications have to be done, and they are probably the more common kind of headaches as compared to secondary headaches. So, in primary headaches, the prototype headache is the migraine, which you all must have experienced some or the other time in life. You usually have a unilateral or a bilateral throbbing kind of a headache. You have nausea. You feel like the light is really bad. Sound makes it worse. Stressful events makes it really worse. And the most important thing, when you go to sleep, you have a sound sleep. The next time you get up, you feel a lot better. So this is what this classical prototype of a migraine is. Although there's a lot of overlap. Sometimes even the structural pathologies can present as a migraine. I have a lot of patients who had pituitary macroadenoma, and they actually walked into the clinic saying that this is a migraine, and I even treated them for migraine. But eventually, when they were not relieved with medications for a couple of months, there is time when I decided that we'll go for a radio imaging, and I did find at times patients have structural pathology. Rarely that happens, that even structural pathologies can present as a prototype of a migraine headache. Second important thing is the tension type headache. So tension type headache is again like a migraine. Only thing is that you do not have a throbbing kind of a headache. You may or may not have photophobia, phonophobia. The most important thing is they're usually associated with a lot of stressful conditions. You classically feel a tight band-like sensation choking onto your both temporal areas, as if somebody has put a band on your head. And it's that stiff feeling, or a curving kind of feeling that you get in the headache. So that is probably a prototype of a tension type of headache. Then there is this family known as trigeminal cephalgias with autonomic features, or trigeminal autonomic cephalgias, as and when you like to call it. So there you usually have a unilateral kind of a headache. It's localized to one particular side. The most important thing that defines this kind of a family of headache is you will have autonomic features along with it. So you have either redness of eyes, so you have headache and you have a severe redness of the ipsilateral eye, or you have feeling of a nasal congestion. There's a stuffiness of nose. There's rhinorrhea or there's lacrimation going on along with this headache. And the moment headache stops, even these symptoms, these autonomic symptoms, they subside down. So that is a prototype of a trigeminal autonomic cephalgias. And you have various types of trigeminal cephalgic autonomic headaches. So you have this SUNCT, you have SUNA, you have paroxysmal hemicrania. So basically, all of them are differentiated by the time duration. So in case of paroxysmal hemicrania, you will usually have headaches lasting for around 30 minutes. In cluster headache, they can last for around 15 to 20 minutes. In paroxysmal hemicrania, they will last for around 30 minutes to 3 hours. In Sankt-Suna, they are very severe stabbing kind of headaches localized to, the V1 distribution of trigeminal nerve, and they are very transient. They may last like 1 to 2 seconds. The most important point in them is they recur very frequently, and you can have episodes up to like 100 per day, having this stabbing kind of a headache. So these are the major kind of the primary headaches that you deal with. Along with that, you have many different types of primary headache. There's a primary exertional headache that a lot of people have. So you have a exertion, you have a stressful day, or you have a you had made a travel, and suddenly you have this new onset headache coming into picture. So that those patients are usually the one who have primary exertional kind of a headache. Having said this all things, in general, I just want you people to know that if you have been suffering from this headache for really long, and it's bothersome. I know I have a lot of patients whose daily activities, whose day-to-day work is getting affected because of headache. So it's always better to consult a doctor, preferably a neurologist. And if you feel, as I told, the warning and red flag signs are there, then you must definitely see a doctor at earliest. If you have tried a lot of therapies but it's not working out, then probably you need to visit a neurologist, or you need to do a radio imaging. You need to do a next level investigations. So there's a lot of therapies, there are a lot of treatment available for headaches, especially the primary headaches. And recently, even injection Botox and injection of lignocaine, the gone block, retrooccipital nerve block, the supraorbital nerve block. So there are a lot of new recent advances that have taken place in the field of headache. So patients, a lot of my patients, they are not very relieved with the classical migraine medication of the propanol, triptomer, or the topiramate. So I have shifted. I give them an option of having this greater occipital nerve block, and the supraorbital nerve blocks, and probably the injection Botox, which usually has a better safety profile, because they act locally. They do not enter your system, and they do not cause side effects as other medication, the oral medications do. And most important thing is they have an effect which is usually longer. So a Botox injection classically lasts for around 3 months. A gone block may last for around 1 week to 2 weeks. It depends. I have patients who have relief of gone block, say, for around a month as well. So having said this, a lot of recent advances that have been made in field of headache. And it's always better to if you are feeling that your lifestyle is getting affected, your work is getting affected, your concentration is getting affected, your studies are getting affected, so you definitely need to address this issue. You need to visit a doc, and you need to start the treatment straight away. Certain important things that I would like to tell you, common daily things that you can do to avoid precipitation of these primary kind of headaches is, there are four important things in day-to-day life that we usually neglect, that can contribute to making our headaches really worse. So first and foremost important thing is sleep. So if you do not have an adequate sleep, the kind of neurotransmitter or the relaxing neurotransmitters that are required inside your brain, the level of those neurotransmitters, the GABA, usually goes down. And then the precipitation of these events are very frequent. Second important thing is any stressful event, like even this the season that we have right now, like a lot of heat, a lot of sun exposure to direct bright light, that can precipitate a event of migraine or a primary headache. Third important thing is fasting for really long, and sitting in front of a computer or a screen like this, where there's a lot of bright light, can be a normal trigger for most of the primary kind of headaches. So this very reasonable lifestyle modifications, that keeping yourself hydrated is yet another important thing. So these kind of primary headaches are even worse in people who have dehydrated kind of a status. They do not have an adequate water intake. So these are very few important lifestyle modifications that you can try out. You need to focus on them, and you will see that definitely on the long run they actually benefit more than the medications. That is what I have seen. So this is what the take home message that I want you all to know about headaches.
Thank you, sir. Thank you very much for your detailed elaboration on headache. So we are. I'm seeing few questions on the chat box, sir.
Yeah.
One of our viewers is asking about, sir, cousin experience a sudden headache very often, and it continues in time intervals, and mostly it occurs due to movement like climbing stairs or head movement or bending down. So please need your advice on this kind of headache.
See, if you have headaches which are worsening on head movements, so that can be primary headache as well. If you have a headache like migraine and you have head movements, then it can be really worse. But if your headache is starting due to head movements, I mean, when you don't have a headache, but the moment you look down and you have onset of headache, that is pointing out towards a structural pathology or a secondary kind of a headache. So I would, having said this, I would still say that you can visit a nearby neurologist or any expert, headache expert, and it's better to get evaluated. But I would still feel that this is more towards, as I said, if it's a headache which is getting worse with head movements, that still can be a primary headache or migraine. But headache, if it's starting with the head movement, then probably you need to get a radio imaging done immediately or as soon as possible.
Right, sir. And the next question is like, sir, sometimes is the headache is curable? It's if it is a migraine type headache.
Yeah, so this is very important question that migraine is, not like a disease. I would rather not say that migraine is a disease. I mean, we all had COVID, and finally we came to conclusion that we need to know how to live with the COVID situation. So we have made a lot of lifestyle modification which are really annoying. Like you need to have a frequent hand wash, or probably frequently you need to wear mask outside. But still, you do address those issues because you know that probably it has doing all this will save your life much more than doing anything else. So similarly, migraine, I would not say that it is, some people have it and they do not address the issue. They do not think about the relieving factors or precipitating factors or the lifestyle modification as a permanent therapy for their migraine. They usually look for medications, and I will frankly tell you that migraine is something, like it occurs in bouts, then it resolves down. Then probably if you have a aggravating factor or aggravating factor coming into play, it again comes up. Then again with the relieving factors, with medication, it again comes down. So you don't need to know about curable or non curable. It is something like a diabetes, something like a hypertension. When you have migraine, you need to know to live with migraine. You need to know what you should do, you need to know what you should not do. That probably is the best cure possible. If you have severe headaches, you have an acute exacerbation, you have an acute bout of headache coming into your life, probably that is a time you need a prophylaxis, or you need a medication. But when you do not have the headache, how aggressive you are on your lifestyle modification, how aggressive you are on your practices is what makes migraine actually remit and keep that what helps keeping the migraine in remission on a long term.
And thank you, sir. Sir, the next question is there any hygiene factor in daily life that can maintain to avoid headache?
Yeah, this is very important question that you have asked me, and this is very essential that that somebody asked me. So let me tell you, the trigeminal neuralgias and a lot of headaches have been linked to a bad oral hygiene. That's the first thing. So if you keep a good oral hygiene, probably you are trying, you have already saved yourself from certain types of headaches. So that is very important thing. Second important thing is sleep hygiene. So sleep hygiene is again a very important thing. We all Indians have a very common habit that we drink tea or coffee at 6 p.m., 7 p.m. in the evening time, and we feel ki everybody is doing it, so it must be right. Now this is very odd because the whole idea of having tea or coffee came from the western world, where they usually do not take it beyond 3 p.m. So in India also, I would tell people that sleep hygiene is very important. So probably if you sleep at 10 p.m. You need to finish all your food, all your drinks by 8 p.m. You need to void, and then you need to go to sleep to have a sound sleep. Any coffee, any tea, if you are very interested in drinking it, probably in the morning time is the best time when you can energize yourself. Any tea or coffee beyond 3 to 4 p.m. will try to push your sleep latency backward, and if you do not have a good sleep, then you are definitely predisposing yourself to the migraine. Third important thing is ki, a natural technique that relieves the migraine, or kind of prevents you from migraine, is daily bathing. So if you have daily bathing like almost like twice a day, then probably you are trying to in a way cool your system down, so heat, which is a natural precipitating factor for migraine, doesn't get inside your nerves, and it definitely helps to prevent many attacks of migraine. So hygiene is definitely important, as I told you. So these three is the most common and very easy hygiene techniques that people can get into the install in their life, and they can actually benefit a lot out of it.
Okay, thank you, sir. And the next question is, sometimes we are seeing that when a people is facing any kind of headache without knowing it is a primary headache or secondary headache, what they usually do, usually take go to the medicine shop and take over the counter. So, what is the advice for them, sir?
So again, a very important question. So the thing is, ki what I say to my patients and to everybody is that if you have analgesic use of more or at least 4 times a month, I mean you are taking analgesics over the counter for beyond 4 or 4 times a month, that is the time when you need to see a doc. That is beyond a usual frequency, and we all have, at times we all have headaches, so we do consume a paracetamol or we do consume an analgesic. Once in a while is fine, but if you have a frequency of more than 4 or even 4, that is the time you need to hit to immediately you need to see a neurologist or a doctor.
Okay, so thank you, sir. Sir, as of now, I'm not seeing any more questions. So, sir, we are extremely honored to get the opportunity to facilitate the proceedings and the success of the Alteus ACME Web with expert on general awareness on headache by Dr. Pradeep Tiwari. The discussions and the active participations of all who are present via Facebook Live this afternoon was really motivating for Altius, and we promise to organize these types of ACME in future. And thank you, sir, for your detailed elaboration and detailed answer, your answer for all the questions. So thank you for your auspicious presence and participation in this program, sir. Thank you,
Thanks
sir.
a lot, and even I would like to, thank the whole Alteus team, because it's very important to have this kind of a platform where the people and the specialists, they directly communicate, and there's a direct one-on-one question and answer sessions. So again, a lot of thanks to the whole Alteus team.
Thank you very much, sir. Thank you so
Thank you,
much.
thank you.